Welcome. My name is Chris Rowena, Lead Communications Analyst at Health Workforce Development. We're excited that you've joined us today for the Medi-Cal Behavioral Health Student Loan Repayment Program informational webinar. Here's the agenda for today. We're going to start with some housekeeping and an introduction, followed by some opening remarks and an overview of HCAI. From there, we will go through the Medi-Cal Behavioral Health Student Loan Repayment Program webinar objectives. We will talk about the overview of BH Connect and the workforce initiative associated with it. We will go into the Medi-Cal Behavioral Health Student Loan Repayment Program overview. And then at the end, we're going to have questions and answers and some closing remarks. Lastly, before we begin, I'd like to go over the housekeeping. This webinar is hosted in Microsoft Teams. If you are not familiar with the platform, you can find the chat and the view controls in the menu bar at the top of your screens. The chat option will be open for asking questions during the Q&A session, which is again at the end of this webinar. This webinar is being recorded and will be available within 7 to 10 business days on our website. And an additional webinar will be held prior to the launch of the program in July. And with that, it is my pleasure to introduce Dr. Sharmil Shah, Behavioral Health and Policy Branch Chief for Health Workforce Development, for our opening remarks.
Thank you, Chris. Good afternoon, everyone. Thank you for joining us today for this informational webinar on the BH Connect Medi-Cal Behavioral Health Student Loan Repayment Program. We're so excited to have so many of you with us, behavioral health professionals, organizational leaders, and students who are interested in learning more about this important opportunity. As you all know, California is facing a significant behavioral health workforce shortage, and the BH Connect Workforce Initiative is one way we're working to address it. In partnership with the Department of Healthcare Services, this program is funded through a Section 1115 demonstration waiver that seeks to expand the number of behavioral health professionals who are delivering services to Medi-Cal members and uninsured clients, and is designed to support and retain behavioral health providers, particularly in underserved and high-need communities, by helping to reduce the burden of student loan debt. Today's session will walk you through the key aspects of the program, including eligibility requirements, application timelines, award amounts, and how organizations and individuals can participate. We will do our best to address your questions and ensure you have the information needed to apply or to support others in the process. However, please note that we may not be able to respond to all inquiries during today's webinar. For any unanswered questions, you are welcome to contact us at mbhslrp@hcai.ca.gov, and we will follow up with additional information as it becomes available. That email address will also be available on our last slide if you missed it. So we're very grateful for your time and interest, and we hope this webinar helps you take that next step, whether that's applying yourself or helping others to do so. Thank you again for being here. So let's get started. HCAI's vision and mission, just wanted to spend a few minutes here. Our vision is to have a healthier California where all receive equitable, affordable, and quality health care. HCAI's mission is to expand equitable access to quality, affordable health care for all Californians through resilient facilities, actionable information, and the health workforce that each community needs. These are some of our HCAI program areas. As I indicated, facilities. This is where we monitor the construction, renovation, and seismic safety of California hospitals and their skilled nursing facilities. We also have financing programs where we provide loan insurance for nonprofit healthcare facilities. Our workforce, which is where this program resides, is to expand and diversify California's health workforce for underserved areas and populations. We also work in data where we collect, manage, analyze, and report actionable information about California's healthcare landscape. And lastly, affordability. We improve healthcare affordability through data analysis, spending targets, and measures. So we also enforce hospital billing protections and provide generic drugs at a low, transparent price. Next slide, please. We have our health workforce approach and strategy is to ensure that we enable the expansion and development of a health workforce that reflects California's diversity while addressing supply shortages and inequities. And we do this by administering programs and funding and publishing actionable data about California's health workforce and training. And our programs cut across 4 areas: behavioral health, nursing and midwifery, primary care, and oral health. And it's really important to emphasize that our workforce approach and strategy helps develop, support, and expand a health workforce that serves medically underserved areas, serves Medi-Cal members, and represents the California it serves through racial and language diversity. And these are some of the ways that we do that. We provide financial support for organizations through building the workforce pipeline, organizations expanding education capacity, individuals pursuing health careers, and organizations supporting providers and addressing retention. So now I'm going to go over what the objectives are for today regarding this program. We will present a high-level overview of BH Connect and the BH Connect Workforce Initiative. We'll present high-level features of the BH Connect Student Loan Repayment Program, and we'll provide next steps for organizations to spread the word to eligible applicants. So let's go into the overview. As many of you may know, BH Connect is a very large initiative, of which the BH Connect Workforce Initiative is a piece. In mid-December, the Department of Healthcare Services received approval from the Centers for Medicare and Medicaid Services, CMS, for the transformative BH Connect initiative. And it grows out of an understanding of the lived experience of Californians with behavioral health needs and data-driven analysis of those available services. BH Connect seeks to transform California's behavioral health delivery system by expanding access, strengthening the behavioral health workforce, and ensuring that all Medi-Cal members receive high-quality care. And CMS has approved key elements of BH Connect through a new Section 1115 demonstration and a series of new state plan amendments. Next slide, please. These are some of the goals of BH Connect. As I indicated before, it's part of a larger continuum of care. But a couple of the ones I would like to highlight here are that they expand the continuum of community-based services and evidence-based practices, strengthen family-based services and supports, strengthen the workforce, which is where we will be talking about today, promote transitions out of facility-based care, and improve stability. Next slide, please. So the BH Connect Workforce Initiative, of which HCAI is a part of, it supports the training, recruitment, and retention of behavioral health practitioners to provide services across the continuum of care within the Medi-Cal safety net, serving Medi-Cal members and the uninsured. So between 2025 and 2029, in partnership with the Department of Healthcare Services, HCAI will invest up to $1.9 billion in 5 specific workforce programs. And recipients of this workforce funding will commit to serving Medi-Cal members living with significant behavioral health needs for at least 2 to 4 years. One caveat that I wanted to share is that the state may carry unused workforce initiative expenditure authority from one year to the next. So after demonstration year 2, the state may redistribute up to 30% of workforce initiative funding across programs. Here is a list of the 5 workforce initiative programs. The first one is the one we'll be talking about today, Medi-Cal Behavioral Health Student Loan Repayment Program. We also will be launching a scholarship program, a recruitment and retention program, a community-based provider training program, and a health residency training program as well. So without further ado, I'm going to go ahead and pass it over to our policy analyst, Christian Jones, who will give us the overview. Thank you.
Howdy, friends. Thank you, Sharmil, for that great introduction to HCAI and to BH Connect. My name is Christian Jones. I'm the policy analyst here at HCAI. I'm working on the Medi-Cal Behavioral Health Student Loan Repayment Program. The goal of this program is to expand the availability of behavioral health practitioners in Medi-Cal safety net settings by alleviating their student loan debts and incentivizing practice in these settings. So continued employment or for somebody to begin employment in these settings. Next slide. We have up to $90 million available for this year's MBH SLRP cycle. I said SLRP, sorry, SLRP. That's our little internal joke about the program. Individuals are eligible for up to $240,000 in loan repayment, depending on their profession. We'll have a slide that can walk through the levels of loan repayment that you're going to be eligible for. And just to note, these amounts and also most of the things that we're going to talk about throughout today's webinar are determined by the special terms and conditions of BH Connect. So we signed an agreement with CMS, that's the federal government, that lays out the terms and conditions that we have to abide by when administering this program and also all of our other BH Connect workforce initiatives. So we might be referring to an STC document. That's the document that we're referring to if we're saying the STCs say this or that. Next slide. So first, who can actually apply? What are the eligible professions? So here we have a long list of professions. Please bear with me as I go through them. But eligible professions are addiction medicine physicians, alcohol and other drug counselors, associate clinical social workers, marriage and family therapists, professional clinical counselors, certified peer support specialists, certified wellness coaches, licensed clinical psychologists, clinical social workers, and marriage and family therapists, and professional clinical counselors, licensed psychiatric technicians, a Medi-Cal community health worker, occupational therapists, physician assistants, psychiatrists, psychiatric mental health nurse practitioners, psychiatric registered nurses, or any other registered nurse working in a qualified behavioral health setting, and registered psychological associates. This list is not totally done yet, so there's going to be other behavioral health practitioners that may meet the eligible professional criterion, but they have to meet the provider qualifications for Medi-Cal specialty mental health, drug Medi-Cal, or drug Medi-Cal organized delivery system services. Any questions about those categories? We have the HCS on this call to answer questions about those categories. I will also note that the certified wellness coach, there is a SPA that has been submitted, a state plan amendment that was submitted to the federal government. We will know by the time this application launches whether that's approved or not. But if that SPA for some reason is not approved, then certified wellness coaches will not be an eligible profession. And also it's contingent upon state budget authority. So if we don't get the state budget authority for that SPA, certified wellness coaches will also not be eligible for the program. Slide. So here we have maximum awards by professions. Here's all of the professions I listed on the prior slide, and they're broken up into 3 categories. So this top category is going to be licensed practitioners that are able to prescribe medicine. So psychiatrists, psychiatric mental health nurse practitioners, child and adolescent psychiatrists, addiction psychiatrists, and addiction medicine physician. So all of those are licensed and also prescribed, and they are eligible for up to $240,000 in loan repayment. This second category is licensed non-prescribing practitioners or their associate counterparts. So you have your clinical social workers, clinical psychologists, professional clinical counselors, marriage and family therapists, psychiatric technician, occupational therapists, and registered psychological associates. Those are all eligible for up to $180,000 of loan repayment. Anybody in those 2 categories is going to serve a 4-year service obligation. More on that in the next slide. And in this final category, we have our non-licensed and non-prescribing professions. So your alcohol and other drug counselors, certified peer support specialists, certified wellness coaches, your community health workers, and your registered nurses. They are eligible for up to $120,000 of loan repayment. and then their service obligation is dependent on how much loan repayment they're receiving. And we'll go into detail on the next slide. So this is basically what I just said about service obligations in the past slide. So licensed prescribing behavioral health practitioners and non-prescribing licensed or associate level pre-licensure practitioners will serve a 4-year service obligation regardless of the loan repayment amount. I want to emphasize this point. If you are in those categories and that's what you're seeking loan repayment for, if you get $1 of loan repayment, it is still a 4-year service obligation. If you get $180,000 of loan repayment, it is a 4-year service obligation. So it's not in any way determined by how much money you're given. But if you're in the non-licensed, non-prescribing category, for $200,000 or greater, it's a 4-year service obligation. Between $10,000 and $20,000 is 3 years, and then less than $10,000 is 2 years of service obligation. Next slide. So all service obligations have to be served, one, full-time, and you're going to get a definition of full-time in our grant guide, but a full-time service obligation, and it has to be served in what is called a Medi-Cal safety net setting. That's a definition ripped from the standard, the special terms and conditions, and this is unchangeable. This has to be this way. It's prescribed in the agreement we have with the federal government. So a Medi-Cal safety net setting is a federally qualified health center or a community mental health center or a rural health clinic or a setting with the following payer mix. So a hospital that serves 40% or higher Medicaid or uninsured population, a rural hospital with 30% or higher Medicaid or uninsured, or other behavioral health settings with 40% or higher Medicaid or uninsured population. Next slide. So that other category can be like, you might want a larger definition of what that might mean. So here we have some examples of what that would be. So their other behavioral health settings are organizations that, one, are enrolled in Medi-Cal, they deliver Medi-Cal covered behavioral health services, and they meet the payer mix requirements on the previous slide. And here is just a list of example organizations, but it's not a comprehensive list. DHCS and HCAI are working to further assess potential setting types, and we're going to have guidance for you by the time the actual program is launched in our grant guide. Next slide. So the actual important dates. The application will open in July. That's a long way away. And then the deadline for that application will be August 15th. So you have about a month and a half to submit an application. And we anticipate giving award notices out in November of this year, and then grant agreements will start in December of this year. Slide. Thank you guys so much for your time. I'm going to pass it to Chris Rowena and Lindsay to do our question and answer section.
All right, thank you so much, Christian. As you can see, our team's already put a lot of work into this program, and we have a lot more to do, but we're excited that you've joined us today to learn more. We're going to transition into our question and answer session at this time. In the menu bar at the top of your screen, you can find the button to access the chat feature. In that chat feature, you can type your questions in there. We do have a lot of people on the webinar today, and so we are going to be interacting just through the chat so that we can get through as many questions as possible. Before we get started, I want to introduce Lindsay Bradshaw. She's one of our BH Connect program managers who will be joining me to help facilitate the Q&A session. Lindsay.
Thanks, Chris. Hi, everyone. Thank you all for being here today, and we're really excited to hear your questions. Just wanted to emphasize something that Sharmil said at the start of this webinar, which is that, acknowledging that today's session is intended to be an early informational overview, and some of the program details are still being finalized. So because of that, there may be some questions that we aren't able to answer today. So that said, we're committed to keeping you all informed. We will be hosting a webinar in early July, shortly after the program application launches on July 1st. So at that webinar, we anticipate being able to answer all of the detailed and specific questions. But for today, please feel free, don't hesitate to ask your questions, and we'll do our best to answer what we can, and we'll note what we can follow up on in July. So with that, Chris, I think we can get going on chat questions.
Fantastic. Well, let's jump on in. First question comes from Megan Robles. Do online BH case managers through IEHP count under other?
Thanks, Chris. Let's pass this question to Paula.
Yeah, thank you all. Paula Wilhelm with Department of Healthcare Services. I'm a Deputy Director for Behavioral Health. And I think that is an possibly it depends is the answer. There are, to elaborate a little bit on what Christian mentioned earlier, when we refer to sort of other providers that may qualify, there is a reference in the special terms and conditions to practitioner types as defined in our state plan specific to specialty mental health services, drug Medi-Cal, or the drug Medi-Cal organized delivery system. And so for those three sections of the state plan, there are lists of practitioner credentials. And we certainly cover case management in the specialty system, but the individual would need to have a credential that matches what is in the state plan for specialty mental health, drug Medi-Cal, or drug Medi-Cal organized delivery system. So that's part one. Be working at a qualifying behavioral health service site, or be ready to serve their service commitment at a qualifying behavioral health service site, and then have educational debt. So there's several conditions that have to be met.
All right, thank you, Paula. Okay, Kylie Thompson asks, what about at a school district, an MFT?
Paula will let you answer that one too.
Yes. And I think Christian alluded to this as well. There are some, again, since the focus of the program, first and foremost, because we are funding it through BH Connect, is to support workforce development in the specialty behavioral health system. We had a list of specialty behavioral health specific sites that clearly qualify as behavioral health settings under the language in the STCs. And then there are some sites, including school-based sites, where DHCS and HCAI still need to do a little bit of work to determine how we would distinguish a school that qualifies as a behavioral health site, right? Because not necessarily every school would. So this is something where we anticipate coming back in that, is it June or July, HCAI colleagues, in the subsequent webinar, and being able to provide a little more detail about some of these sites that are not necessarily clear at this point.
Right, thank you. Next question comes from Monica. How are the 4 years accounted for? Does it begin upon enrollment in the loan repayment program, or will prior years in Medi-Cal settings be honored?
Christian?
It's going to begin right when you sign your grant agreement with us. So this is not retroactive. We're not paying you loan repayment for service you've done before. We're giving you loan repayment for a service commitment you are yet to serve.
All right, thank you, Christian. I did want to note, I do see a couple hands up, and at this time, we're not going to be able to call on people individually for question and answer. If you're unable to access the chat feature for some reason, we know sometimes individual organization security protocols don't allow the chat. We ask that you just email us at the mbhslrp@hci.ca.gov with your questions, and we'll make sure we get those answered for you. Continuing in the chat, so got a question from Mark. Are they paid programs as well as award of tuition assistance?
We might need to get a little clarity on this question, but Christian, is that something you're able to answer?
No, I would need a little bit more clarity as to what is being asked.
All right, Mark, go ahead and give us a little more context to that question, and we'll come back when we get to that. Thank you. All right, next question, are FQHC /LAL eligible?
Let's pass that to Paula.
So FQHCs are explicitly called out in the special terms and conditions as a qualifying site. And I was scrolling through the chat because I wasn't sure what the /LAL meant. So if anybody wants to elaborate on that, happy to say more.
Great, thank you. Let's see. Next question. Do ABA therapists count?
Paula?
So applied behavioral analysis, I believe, is what people are asking about when they reference ABA. And this is a great question. ABA is not actually classified as a behavioral health benefit in Medi-Cal, nor is it a specialty behavioral health benefit. And so those practitioner types are not the practitioners that we are able to fund through this program. So that's a no.
Right. And one more on eligible. Are licensed vocational nurses an eligible profession?
Paula?
Yes, thank you. An LVN could be, that is a specialty behavioral health provider type. But again, as we mentioned, would also need to be serving the service commitment at a qualifying site. And we anticipate providing some more specificity on sort of the array or continuum of qualifying sites as we're able to put out the application materials.
All right, thank you. Lisa asks, what happens if the payer mix changes from year to year?
Chris will let, I think we can let Christian answer that one. And then after that, I did want to call out, there's a question we skipped, which I think is important, which is what is considered full-time. But Christian, are you able to support what happens if the payer mix changes from year to year?
Yeah, so when you're serving your service obligation, the payer mix, if you're in one of those other behavioral health setting types, and that's the basis of your eligibility for the loan repayment, that it always has to be true that you're serving at an eligible site. So if you're serving at a site that you think is right at the threshold, say you're working in some sort of other behavioral health setting and it's 40% and it's in one of those 40% categories, I would really advise you to try to find a place where it's not always you on the threshold of that 40%. So really have clarity that, hey, for the next 4 years, 3 years, 2 years, depending on the service obligation you're serving, that across time, that will be an eligible setting for you.
All right, thank you, Christian. Let's go back to that question on what is considered full-time.
Thanks. Christian, are you able to take this one? Are we ready to share this answer?
Yeah, we still have to finalize the definition of full-time. I can tell you how HCAI traditionally has defined full-time. I'm not going to promise that this is where we land because we still have to develop the grant guide for the program and release it. But traditionally, HCAI defines full-time as 32 direct client hours a week, or 30 hours in a school setting. So that is our traditional definition, but again, no promises that that's going to be our finalized definition for this program because we still have to go through the program elements and review the grant guide.
Thank you. Stephanie asks, can private practice clinicians apply for this if they accept Medi-Cal?
Paula.
Yeah, thank you. So potentially, yes, if you are hold one of the licensure types that qualifies as a specialty behavioral health practitioner, for example, and you are contracted to work for a county mental health plan, and you serve, at least 40%, right, Medi-Cal, consistent with these special terms and conditions, then you could potentially qualify. But again, you need to meet all those criteria. So trying to be careful not to say that every private practitioner will qualify, if that makes sense.
Ebony asks, what would Department of Mental Health fall under?
I think this might be a combination answer, but I'm going to start with Christian because I believe this falls under the clause of state employee. Christian, and we can speak to that.
It would depend on what you meant by Department of Mental Health. So if you're a state employee, there's a really complicated answer to that question if you're a state employee. So please email us if that's the case, and we'll just email you the information. If you're referring to a county department of mental health, like you work for a county, that would most likely be a Medi-Cal safety net site. So I would encourage you to look at the program.
Thanks. Anything you want to add to that, Paula?
That made sense to me. Agree, Christian. Thank you.
Fantastic. Next question is, will CNAs be eligible?
Paula.
Similarly, I am scrolling through to sort of check the list. CNAs, I believe, are not necessarily one of our specialty behavioral health practitioner types. So that is the list that we want people to start with. As mentioned, is the list of individuals who can provide specialty mental health, drug Medi-Cal, or drug Medi-Cal organized delivery system services. And I will pull that up and double check myself while we continue with the Q&A so that I don't misspeak.
All right, thank you. Brittany asks, does it conflict with PSLF?
Yes, I think this is a question for Christian. Does it conflict with public service loan forgiveness?
I don't think I can really give an answer because that's a federal program and I can't really speak to how their conflicts work. I would encourage you to think about in your current situation, depending on how much debt you have and also how much years of service you already have, whether it makes sense for you to apply to this versus seeking public service loan forgiveness. I do understand that a lot of the Medi-Cal safety net settings that if you work in would make you eligible for the program, given other requirements, are also settings that would make you eligible for public service loan forgiveness. So again, I would just look at your individual circumstances to see which program makes sense for you.
And Christian, we can add, right, that we know for sure that if you have an existing service obligation, that will be a conflict with this program. And it sounds like we can offer more detailed answers on PSLF in the July webinar.
Yeah, so PSLF isn't a service obligation. You don't sign up for it and then owe the government the service obligation. It just counts your years of service in particular setting types. And after a certain amount of years, depending on which category you fall in, you get all of your loans forgiven depending on the kind and category of loan that you have. It's basically, there's a marketplace of loan forgiveness programs, and our program is in that marketplace, and public service loan forgiveness is also in that marketplace. And I would encourage you to, as any good person would, look at the marketplace and see which best suits your individual circumstance.
Thanks, Christian.
Right. Let's see. Next question. How recent clinical psychologists who are not licensed yet are going through postdoctorate qualifies?
Paula or Christian, whoever wants to offer a response to this one.
I think that's a great one to send in writing so that we can confirm. And again, it's a combination of factors, right? Being an eligible specialty behavioral health provider type, having the qualifying service site. And we do have what we refer to as clinical trainees that are eligible to provide specialty behavioral health services, but I'm not familiar enough with the training pathway for each licensed category to immediately say that in response to your question, you would qualify. So some nuances here that we'll have to keep working to clarify.
All right, thank you, Paula. Emily asks, does retroactive service count, or does the grant award start a new 4-year commitment?
Christian.
Yeah, it starts a new 4-year commitment. Retroactive service doesn't count.
And Mark asks, where does one find a list of approved sites, i.e. hospitals, agencies, etc., for an MFT?
I can say on this one that we will offer more specifics in the grant guide, which we will post when we open the program application on July 1st. Christian, did you want to add anything to that?
Yeah, I just wanted to say, like, we'll have, as best as we can, we're going to have a list, but the list, like, we will not be able to tell you post, like, pre-application, whether you're in an eligible site. That's only going to be determined when you apply to us and we do the eligibility checks.
Can I add something as well, Lindsay and Christian? And please,
Yeah.
please continue to add or amend if I'm not being clear. But I think all the questions about who qualifies are great ones. And as Christian said, we'll continue to try to answer as many of those as we can and also provide more specificity in July. But I think one nuance that I wanted to bring up is obviously we have a limited amount of funding available in each cycle. And so the other important note is meeting the criteria for practitioner type and potentially qualifying site does not necessarily mean that an individual will get an award. One of the conditions that we also negotiated with federal partners for this program is that HCAI and DHCS are expected to make some decisions about how to prioritize awards in the event we are oversubscribed, using what we know about, for example, geographic shortages or specific provider type shortages. So just wanted to emphasize, I think we'll give the best information we can to clarify who is eligible. But then we do have the amount of funding that we have, and it is possible that not everybody who applies and is eligible will receive an award.
All right, thank you for that clarification, Paula. Does employment at a for-profit setting, is that eligible?
Paula, is that something you can take?
Great question. I think the short answer is that the special terms and conditions don't distinguish between nonprofit and for-profit settings. The criteria are around proportion of Medi-Cal or uninsured clients served, as you saw. So DHCS and HCAI can certainly include applicants from for-profit who are intending to serve at a for-profit setting that otherwise meets the criteria. So I think, again, we'll have to, again, sort of provide some more clarity on that at the time of application.
All right, next question is, are CBO services CHW eligible?
Paula, let's give this one to you.
Oops, sorry, bobble with the mute button. I'm thinking what is behind this question, if CBO means community-based organization, is some folks might be wondering, because of the emphasis on the specialty behavioral health system, which is county administered, if only county-based or county-employed practitioners are eligible. So assuming that's the question, then the answer would be that practitioners who work at a community-based organization that meets the Medi-Cal behavioral health setting criteria can be eligible. It is not limited to county behavioral health staff or practitioners. So hopefully that's the question you meant to ask.
And Paula, is there anything to note about the distinction of Medi-Cal CHWs or no?
Oh, I heard CBO and was the question about CHWs? I'm so sorry.
Sorry, no, it's about CHWs performing services at CBOs.
Okay, so specific to CHWs, yes. So community health workers can be a qualifying provider type. I think some of you are probably following that we just approved enhanced community health worker services for specialty behavioral health delivery systems. So for specialty mental health, drug Medi-Cal or drug Medi-Cal organized delivery systems, CHWs have the same training and other qualification requirements across Medi-Cal, whether they serve at a specialty behavioral health site or somewhere else. So this is very similar to some of the other answers. A CHW may qualify if they're also working at a qualifying behavioral health site.
All right. Let's see. Next question. Christian, do you have a comment you want to add to that before we go to the next question?
Yeah, I just wanted to add the STCs, because we brought up CHWs. So the STCs don't allow us to use loan repayment dollars to pay for degrees that are entirely unrelated to you receiving a profession. So let's say you're a CHW, but you got an unrelated bachelor's degree to go towards some other profession, or you just felt like getting that bachelor's degree. The SDCs don't allow us to pay loan repayment for that degree that didn't lead to you becoming a CHW. So it's going to be an important note for some people who have gone on to get higher degrees than one needed for their current profession, and that might inhibit you from wanting to apply to the program.
All right, that's a good note. Thank you, Christian. Carolina asks, I do compliance, audit, and monitoring for our providers within my county. Do I qualify under any of these categories?
We may need additional information on this. Paula, are you able to answer this question?
So that this program is really focused on individuals who are providing direct services to Medi-Cal clients and then meet the other criteria that we've discussed today. So administrative, if your role is purely administrative, I don't know that you would qualify. And that's probably something HCAI team that we should try to make sure we clarify in the program terms and in our future guidance.
All right. Laura asks, could you clarify a community mental health center?
Paula.
This is an interesting one in California. So the Community Mental Health Center was added to the special terms and conditions because there is a sort of nationally recognized classification of community health centers. In California, I believe CDPH actually offers endorsement and or certification for this, but there's a very, very small number. So that reference in the STCs to community health center may not be super applicable to California, which is part of the reason that you hear us focused on sort of defining that other criteria, which is other behavioral health sites that serve 40% or more Medi-Cal or uninsured, because that is a category that we have a lot of in California.
Right, thank you. Next question. Would a board certified behavior analyst working under a managed health plan qualify?
I think this is a Paula question as well.
Yeah, and I heard behavioral analyst, and so I think this is the same answer as the earlier question that referenced ABA. And so behavioral analysts are not qualifying practitioners under the specialty mental health, drug Medi-Cal, or drug Medi-Cal organized delivery system sections of our state plan. So not eligible for this particular program.
All right, thank you, Paula. Michelle asks, how is loan repayment amount determined?
This will be for Christian.
So in our application, you're going to give us your loan statements and tell us basically how much debt you have that's associated with the education that you've had that relates to your profession. And we're going to define that for you in the actual application. I know that's a complicated thing to actually define, is what are the actual degrees that count towards leading to your profession. We will be defining that in the application for you. But basically, you're going to tell us how much debt that you have. And we're going to work with your loan servicers to come to an agreement on how to pay your loan servicer directly. Interesting note, we're not going to be paying you guys directly. any of this money. It's going to go to your loan servicer to pay off your debt. But basically, you're going to tell us. You're going to tell us your loan amount so that you have, and you're eligible for up to, if you're deemed eligible, you're eligible for up to the maximum in whatever profession category you're in. But we're not going to overpay you. We're not going to overpay the amount of money that your loans are. So if you have $88,000 in loans, you can only receive up to $88,000 in loan repayment.
Right. Thank you, Christian. Let's see. Next question. What is the requirement for seeing clients? Do program managers/supervisors qualify for anything?
I think this will be a Christian question, and we may or may not be able to answer this today.
So this is going to be up to how we define full-time, and just to reiterate, we're still going to have to work that out with our DHCS partners and how we define full-time for purposes of this program. Traditionally, HCAI, under our definition of the hours that count toward full-time, again, it's 32, we say 32 hours in regular settings, and in a school setting, we take it back to 30 hours. But we define supervision as being a part of those hours. So if you're supervising people who are providing services, we treat that the same as providing services directly. That may change for this program because this program has a heavy emphasis on providing services to clients, specifically clients that are suffering from severe mental illness. So that'll be a discussion and something we can provide in the grant guide and in July.
All right. Thank you.
Paula, did you want to add anything to that?
Thank you. That's exactly how I would have answered too, and a really good question.
Right. Ayanna asks, I'm a behavioral health specialist, like a case manager, so would I qualify?
Paula.
This is going to go back to, and maybe HCAI team, maybe we can come up with a little flow chart or something to help people with the application, but it's like the 3 or 4 part test of, do you meet the description or credentials to provide specialty mental health, drug Medi-Cal, or drug Medi-Cal organized delivery system services? So some case managers do, right? There are degree types and credential types there for folks who can provide case management. And then part 2 is, are you prepared to do your service commitment at a qualifying behavioral health site? And part 3, which Christian mentioned, is, do you have qualifying educational debt, right? That was for a degree path necessary to do the work you're doing in behavioral health. So there's a lot of sort of conditions and nuances.
All right. Thank you. Let's see. Next question. This was a good one. Does someone who is working towards an LMFT license but currently has an AMFT license count as a licensed provider?
I think this is a toss-up. I don't know, Christian, Paula.
Yes, associate level practitioners working toward full licensure do qualify as specialty behavioral health practitioner types.
Great. And Chris asks, is there a time limit as to how long someone has to complete their schooling?
Let's pass this to Christian.
So if somebody's currently in school and they're not going to be working on a practice site before the end of the year, they're not going to be eligible for the loan repayment program, because we're going to want you to be serving your service obligation when you sign the grant agreement, which our current plan will be in December of this year. We do have a scholarship program. I'll plug that. That'll be launching next year. So if you're still in school next year, I would revisit us for the scholarship program. I will answer a totally unrelated question, which is that you will have to complete your service obligation by December 31st, 2033. So that's like the end date of all things BH Connect, is that any service obligation that you have will have to end by that date.
All right, thank you. Corey asks, does IEHP fall under the Medi-Cal safety net setting?
Let's pass on to Paula, and then let's circle back. It looks like we missed a question about certified mental health rehabilitation specialists.
Yeah. So Inland Empire Health Plan, and I think the question may be about people who are working on behalf of a health plan or even under provider or network agreement with a health plan to deliver non-specialty mental health services, which IAHP would cover. And the answer again is possibly there are non-specialty mental health sites that could qualify under this program, but it won't be every site and every set of job duties. So again, we have some work to do on the DHCS and HCAI side to specify what sites may qualify. And then, as mentioned, we'll also have to go through the process of figuring out how we will prioritize awards in the event that we are oversubscribed.
All right, thank you. Lindsay, is this the MHRS question that you were
Yes.
referencing? Okay.
Yeah, and we can give that one to Paula once we work through that.
Are MHRS and other qualified providers eligible?
Yeah, so MHRS refers to mental health rehabilitation specialist, and other qualified provider is also a practitioner type that is defined in our Medi-Cal state plan for specialty mental health and drug Medi-Cal organized delivery system services. So very similar to other answers, and sorry to be a broken record. They may qualify, these mental health rehabilitation specialists and other qualified providers, if they are working at a qualifying site and have relevant educational debt. So to Christian's earlier question, the other qualified provider role, for example, doesn't require post, doesn't require anything beyond a high school diploma. So it may be that the debt that someone has there does not qualify for this program, which is loan repayment. We will be able in the future to talk about some of the other BH Connect workforce programs where if you do not have qualifying educational debt for purposes of loan repayment, there may still be some funding available for training and or other needs.
All right, thank you, Paula. Let's see, next question. This is a good one. Does the 4 years start December 2025? And if I refinanced my loans and I'm paying $400 a month, do I stop paying for the 4 years or get that back? How does that work?
Thanks. Let's give that one to Christian.
So first and foremost, you're responsible for your loan. Nothing about this program and whether we award you changes the nature of the fact that you're responsible for your relationship with your loan servicer and whatever agreement you have with them to make payments. The logistics of how that's actually going to work when we decide that we want to award somebody and then we want to work with their loan servicer to actually pay, that's actually a huge thing that we're still yet to figure out. We're going to be providing those details once we have that finalized. But you most likely will have to be making payments until your loan servicer tells you you don't have to anymore. It will not be us that tells you that you can stop paying.
All right, thank you, Christian. Does children's hospitals or are children's hospitals included on the sites, assuming eligible sites?
Paula?
I feel like people are going to throw tomatoes at me when I start to say possibly, right? Because what we are sort of contending with is, there is a broad array as we have structured our Medi-Cal program. There's a broad array of different sites that can provide specialty or non-specialty behavioral health services in Medi-Cal. And what we have to do is give our federal partners who are helping fund this an assurance that when we're awarding someone and they are serving a service commitment, that they are truly working at a site that is focused on providing Medi-Cal behavioral health services, and that the work they are doing is furthering the objectives of the Medi-Cal program and directly supporting behavioral health service provision, right? So you could have a children's hospital with a robust behavioral health program, and we might find that to be a qualifying site. You may have a children's hospital that does not qualify. So again, we'll try to give as much guidance as we can, and it's not entirely black and white as the terms were written.
Perfect. Thank you, Paula. Connie asks, are funds dispersed at the start of the service obligation or after service obligation is completed?
This one, I think we can say that currently the intention is that the funds would be dispersed during the service obligation. And we'll have more details when the program launches in terms of timeline for when those payments go out.
All right, thank you, Lindsay. Starla asks, how will you determine the amount each person gets? Is it first come, first served for the max amount?
Yes, so this one's kind of a combination, I think, between Christian and Paula. So Christian, if you want to speak to maybe the fact that there's eligibility requirements and scoring, and then Paula, if you want to speak to, preferencing particular settings and providers.
Yeah, so just how the application process works, we're taking everybody in at once through an application cycle and then assessing all of those people through one process. So the timing of when you submit an application is going to be wholly unimportant to if you're awarded, other than the fact that you submit it during the application window. So as long as you submit it during the application window, that's fine, but you don't get a benefit for submitting an application earlier. We're going to do an assessment of eligibility based on everything Paul has been saying about eligible sites, eligible practitioner types, eligible education debt, and we're going to make a determination of eligibility. Then we're going to have a scoring mechanism that we're going to use. And also we'll have some language in the grant guide about certain things that we can preference. So outside of scoring, some things we've historically preferenced is geographic preferences. So there are certain regions of California that lack behavioral health professionals across the entire continuum of care. And we tend to preference those regions for awards when comparing applicants. We may have some language related to preferencing severely mentally ill people in the provision of services. So we're going to basically determine eligibility, and then through that scoring process and also our preference process that's related to HCAI's values, DHCS's values, and the purpose of BH Connect, we will take those and make our determination on who gets awarded. Now, we might be undersubscribed. So Paul has been referencing oversubscription. So we might be undersubscribed. So we might just do our eligibility check and we're done and everybody gets awarded. That's a possibility. But if we're oversubscribed, we will have a system for ranking and privileging certain kinds of applicants over others in accordance with the state's interest and the purpose of BH Connect.
And then Christian just also adding to that all of that information that Christian just shared will be clearly laid out in the grant guide so that you guys, so that applicants will know what the eligibility criteria are, what they're being scored on, and will also state HCAI's potential option of preferencing particular applicants or locations. So Paula, go ahead and add if there's anything else you wanted to add to that.
Yeah, thank you. Those were great answers. And I wanted to provide a little bit of context. As was shared at the top, this funding was approved as part of a broader set of policies known as BH Connect, and the BH Connect initiative as a whole is focused on increasing access to and improving sort of the continuum of care for people with very significant behavioral health needs. So this is why I keep referencing these specialty behavioral health delivery systems who typically serve adults and children with more complex mental health needs, or do our specialized SUD treatment beyond what can be done in, say, a primary care environment. So that people with significant needs is the population of focus of BH Connect, and also the population of focus for the Behavioral Health Services Act. And some of the funding going into this program is Behavioral Health Services Act funding. So that backdrop is sort of why you also may see DHCS and HCAI in the event we are oversubscribed and need to do some of that targeting or preferencing focused on funding specialty behavioral health practitioners and sites.
All right, thank you both for those great answers. Karen asks, is there any chance that school psychologists will be included in the list of eligible professionals?
This one's for Paula.
So right now, a school psychologist is not a qualifying specialty behavioral health practitioner type. And so I think that our expectation right now is no, but again, we'll certainly provide sort of more comprehensive guidance on eligible practitioner types and settings as we launch the program. And I think we also, one thing I wanted to add that we had reflected on as we were starting to launch the webinar, DHCS and HCAI, is that this was a fast and complicated sort of approval process to get this program in place. We have very extensive language in our special terms and conditions and a lot of implementation decisions to work through. And so acknowledge that some of you may have received messaging that, for example, certain types of school-based personnel definitely would be included. And today you're hearing us say, possibly they are not, and the picture is a little more complicated than that. And so apologies for some of the, what you're hearing as we work through what the terms are that we agreed to with our federal partners, and how we can be clear as we implement this. And we'll just keep doing our best to answer the questions. And I will say some of the things that you all have lifted up today. It sounds like the HCAI team had thought of all of, or most of them. I hadn't thought of all of them, so we will keep trying to put answers to those together. And thank you all for helping us refine our thinking.
Absolutely, thank you. One of the reasons why we do these webinars. Fantastic. Laura asks, do you need to be a Medi-Cal provider?
Paula.
Yes, and so this is, I'm actually, thank you for this question, because it really is important to mention. This is very atypical to be able to use Medicaid funding to do workforce development. And so when California negotiated this, we're one of just 2 or 3 states that has received this kind of authorization. And the key thing that our federal partners are focused on is, if we're dedicating Medicaid funding to this, are the practitioners that we're developing working for Medicaid programs, right, and helping Medicaid members. And so that's why you'll see that we have those thresholds for payer mix in the criteria for qualifying sites, because we need to be able to demonstrate that our federal dollars are going to help the Medicaid program and Medicaid members. So yes, you do need to be a Medicaid practitioner to qualify.
All right, thank you. Linnea asks, is it pretty straightforward to determine if an agency applies? Will the agency know if they are eligible?
This one I will pass to Christian.
I'm assuming if you're discussing an agency, you just mean whether they're an eligible site. Just a reminder that the loan repayment program is just for individuals. Essentially, we're going to make that determination at the time of our eligibility check post-application. So we're not going to be able to tell you 100% with definitive certainty that you definitely for sure work at an eligible site until we've done our eligibility check after you submitted your application. We can say things like, for sure, FQHCs are eligible, like, because the SDCs are very clear, FQHCs are eligible. But for the vast majority of sites, it's actually very complicated to determine whether it's an eligible site, and that's why we have an application process to determine that.
Thank you, Christian. Next question, are funds provided directly to the staff or to the agency? Do organizations apply on behalf of a staff, or do individuals themselves apply for the funding?
Christian?
So individuals are applying for the funding, but their loan servicer is who receives the funding. So the SDCs are very, very clear about this point. We are not to hand individuals money from this program in any instance. It's specifically banned, specifically called out. The only way this program can operate is if we are paying your loan servicer directly.
All right, thank you. And the next question, do program coordinators supporting frontline staff, assistant program directors, and program directors at a 988 crisis center, we are part of a large community mental health agency, does accept Medi-Cal, do they qualify?
Paula?
Yeah, that's a great question. And I think earlier I mentioned that the focus is likely on practitioners who are directly serving Medi-Cal members. But I do think this is something we need to consider and solidify on our side so that we can provide clear guidance on whether to be specific, whether roles that have partially an administrative function or wholly an administrative function would qualify. And also, I think if you're asking about someone who holds a qualifying credential type, but maybe is working at a access line or a 988 center and directly providing response to crisis calls, that's a great question, and we can be sure to clarify that as we move into July.
All right, thank you. Tamika asks, if you have applied for another grant through HCAI, would you still qualify? It's a great question.
Christian?
It would depend on whether you were awarded. So just merely applying for another grant would not make you ineligible. If you were awarded, though, and you have a service obligation that's related to that grant, and it doesn't end before this one would begin. So on one of our slides, we said our award agreements will start in December of this year. So just as a good heuristic, if the service obligation that you have from that other program extends past December of this year, you're going to be ineligible for at least this cycle of LRP. So we might have additional cycles of LRP because we have funding from the federal government for multiple cycles of LRP. And you might be eligible for a follow-on cycle if your service obligation ends, for example, next year.
All right, thank you. Zoe asks, if our county is not part of BH Connect but meets all the listed qualifications, can our staff still access this loan repayment?
Let's pass this one to Paula, and maybe you can clarify, Paula, about if counties need to be a part of BH Connect.
Yeah, thank you. I'm going to guess that the question might refer to other components of BH Connect where counties are eligible to opt in to offer new benefits. And so if you're asking, I work on behalf of county behavioral health, but my county is not going to opt in to any of those new benefits, then my answer would be that should not affect eligibility for this program. Somebody would still need to be a qualifying practitioner type, work at a site that qualifies. And if, for example, you're at a county-based mental health clinic, that could very well qualify and then have qualifying educational debt.
All right, thank you, Paula. Jessica asks, does it matter the type of loan one has? Are private loans eligible?
Christian?
Our current vision for the program does not restrict the kind of loan, just as long as it's an educational loan and related to the degrees that you needed to be in your current profession.
All right, thank you. Next question, do sites need to apply to be accepted? I work in an opioid treatment program saving mostly Medi-Cal. Is it serving mostly Medi-Cal? Is it similar to HRSA?
So Christian, let's have you take the first part of it, and then perhaps Paula can address if it's similar to HRSA.
Do you restate the question, Chris? I'm so sorry.
Do sites need to apply to be accepted? I work in an opioid treatment program serving mostly Medi-Cal. Is it similar to HRSA?
No. So your site doesn't have to apply to us to become an eligible site to host people who are receiving loan repayment. We're going to make that determination at the time of application with materials that the individual submits, or potentially materials that we contact that individual's employer to receive as a part of the application process.
And Paula, do you have the context to answer if it's similar to HRSA?
I do not. I wondered if that was the part of the question, if HRSA programs require the specific site to apply.
Okay, we might not be able to answer that question today, Chris.
Angelica asks, are county employees who provide fiscal and admin support in health agency programs eligible as other?
Paula?
Yeah, thank you. And I can tell this is an FAQ that we're going to need to address because I think the question I'm hearing is individuals who may be qualifying practitioners or hold behavioral health practitioner credentials and work on behalf of a potentially a county specialty behavioral health site, but their role is partially or primarily administrative or leadership rather than direct services. And that's the one where, I think that has not been the focus of the program, and most likely we would need to exclude those roles if you primarily do administrative work and not direct client services, but we will need to sort of follow up and clarify that in the program instructions.
All right, thank you, Paula. This next question is a good one. What happens if the recipients of the SLRP go on maternity or paternity leave during the 3-year service commitment period? Do you know how situations like this are typically handled? Is the commitment paused during their leave and then resumed upon return to work?
This will be for Christian.
Yeah, so we're developing a leave policy. We're developing that in collaboration with DHCS. We will have that in the grant guide for you to deal with these cases. The rub is that the thing that cannot change under any circumstance is that the service obligation has to end before December 31st, 2033. That is a requirement of the STC, is that service obligations be completed by that time. That's regardless of any leave we grant. It's just one of those things that we can't change. But obviously, you guys are going to be our first cohort of LRP. So if you have a 4-year service obligation, it would end at the end of 2029 or early 2030, depending on when we sign grant agreements. So you have a little bit of flexibility there. And we're going to give you a leave policy that kind of outlines those circumstances.
Thanks, Christian. Andrea asks, how can we be notified once the application goes live?
Chris, is this something that you can answer in terms of signing up for the mailing list?
It is, absolutely. Yeah, one of the best ways you can stay up to date on what HCAI is doing, and including when programs are going live, is signing up for our monthly newsletter. And you can do that by going to our website, and we're going to talk about it at the end of the webinar, but you go to our website, click on subscribe, and then there's going to be a section of options that you choose what you're interested in. Make sure you subscribe to anything under the workforce, the workforce section, health workforce, in particular behavioral health. On that, you'll see that. Click on any of those and you'll be subscribed to our monthly newsletter, and we will send you an email once a month with everything that is opening and happening at HCAI in regards to workforce, health workforce programs.
Thanks, Chris. And then I'll also make a note for everyone to just mark their calendars. We do anticipate launching this application on July 1st. So you can check, it'll be available. The link to apply will be available on the HCAI website. So please check back July 1st.
I'll also add that just by attending this webinar, you will also be put into our listserv for this program. And so you will be getting emails, the updates for the program as well. So Andrea, we got you covered. We'll make sure that those emails are going out just for registering with us today. All right. Next question, does an LEA billing partnership under the CYBHI fee schedule qualify as other, provided the Medi-Cal population is greater than 40%?
Paula, are you able to take this one?
Sorry, there's a little delay on my side with hitting the mute button, but this is one where we're going to need to give further guidance for LEAs and other school-based sites. It is, again, possible that some would qualify, but likely not all. So we need to be more specific and hope to be able to do that by July.
All right, thank you. Katie asks, if staff received loan repayment from their organization through the direct grants to CBOs during FY 25-26, would they be eligible to apply for this opportunity?
Thanks. I'll pass this one to Christian and note that I believe this individual is referring to HCAI's CBO grant program.
Yeah, if I recall, the CBO program has service obligations that are associated with it. And if you are still required to serve a service obligation and that service obligation is not ending by December of this year, you will not be able to apply for this cycle of LRP. But I would look toward future cycles of LRP if you still have educational debt and are willing to serve a 4-year service obligation in an eligible site.
All right. Let's see. Will the award honor retroactive time served in the qualifying setting?
Christian?
It will not. So we are only rewarding you so that you can perform a service obligation in the future. We are not rewarding retroactive service.
All right, thank you. Let's see, do we as an organization need to be 40% or higher Medi-Cal funded, or if we have a program that meets the requirement, would that suffice? We are a community mental health organization.
I believe this, well, maybe Christian, you can take this one. It's a organization versus individual applicant question, I think.
I'm actually going to punt that to Paula.
Sure.
That's I'm also seeing that kind of popping up in more than one place. And I think DHCS and HCAI will probably have to take that back to clarify for you all whether we need to look at the payer mix at the site level or if it is possible to look at it at the organizational level.
All right, thank you, Paula. Next question, if we become fully licensed post-application submission, will our application be converted to license status once we update through the system portal?
Interesting question. Christian?
We currently wouldn't have a mechanism to do that. We can't do post-application adjustments like that because we'd have to give that to everybody that applies. We'd have to let them update their professions like post-award, and we can't do that for everybody. So we can only take the profession and licenses and certifications that you submit to us at the time of application.
Right. Stephanie asks, if we work at a qualified provider as management but do not have a license and do not fit the specific categories listed, such as wellness coach, do we qualify for the $120K tier of repayment for 4 years?
Christian?
You do have to meet the eligible provider requirements. So it's one of the ones that we listed or ones that we'll list in the grant guide once we have our follow-on conversations and specify the specific provider types. But if you're not in one of those eligible provider types, you're not going to be able to be eligible for loan repayment.
Okay. Let's see. Looks like there's still some questions out there regarding school districts. Do the school districts count? We bill for Medi-Cal and billing as mental health providers.
Paula.
Yeah, thank you. And acknowledging this one is going to be an FAQ, so we'll try to provide more information as soon as we can. But sort of backing up again, what we need to work through is that the STCs refer to behavioral health sites with a payer mix of 40% or more uninsured or Medi-Cal. And so we would need to be able to demonstrate to our federal partners that the school-based program or site is primarily offering or, offering to a large degree behavioral health services. And so that's a determination that HCAI and DHCS are still working through to determine how we could identify a school site that is also a behavioral health site and could then potentially qualify.
All right, and we just want to recognize we are starting to run out of time, and we still have a lot of questions regarding am I eligible, but we have some other questions in here that I think apply more broadly, and I want to make sure that we get to some of those. This first one, is there an estimated timeline for receiving confirmation on an application being approved or denied?
Yes. Did we, Christian, list that in the timeline slide?
Yes. So we have an anticipated award date of sometime in November of this year. Obviously, if you're not awarded in that time, we're going to send you something that says that you did not get awarded. So that would be the anticipated time that you would be notified of the status of your application.
A couple questions on what happens if somebody doesn't fulfill their service obligation. If a practitioner doesn't complete it, but the student loan servicer has already received the payment from the SLRP, or just in general, what happens if it is not fulfilled?
Yep.
Got a couple
Go ahead,
questions on
Christian.
that.
Fantastic question, and a very important question. So this is what's called breach. You would be in breach of contract with HCAI, and you would owe us all of that money back. We are going to have a collection agency associated with this program. We hate that circumstance, by the way. It's bad for you, bad for us, bad for everybody involved. It's actually really bad for us because we have to pay back that money to the federal government through a really complicated process that the STCs lays out. So we really don't like that circumstance. But if you don't serve your service obligation, you will owe us all of that money back. So I would heavily encourage you to really consider whether you can provide that service obligation before you apply. And even if we give you an award notice before you sign an agreement with us, please really search into your soul to see if you can actually deliver that service obligation to us, because it is painful for everybody involved if you are unable to provide that.
Also, just adding, Christian, I know you've mentioned this before, but sharing with everyone that we will provide a detailed policy in terms of service obligation suspension or waiver for extenuating extreme circumstances. And that'll be in the grant guide. So you all will be able to see that before you apply in July.
All right, thank you. We are just about out of time, and so we're going to go with one more question, and we do have to transition off of this. You guys have great questions, and if you didn't get your question answered, don't worry. We've got another webinar coming up, and we will have more opportunities for you to ask questions. And so let me find a good last question to close this out here. Let's see. Here's a good one. Are we obligated to remain within our same role for the full 4 years, or is there flexibility in terms of promotion and or lateral transfers within our company?
Christian.
So the key thing is that you are working as one of the eligible providers in your category. So For example, let's say we awarded you as a certified wellness coach, and for some reason you then are, oh my God, I'm an LCSW now. That's great. We love that. That means you can provide better care and more expensive services to people. That's totally allowed. You can be promoted. That's totally allowed. The key thing is that you stay in a Medi-Cal safety net setting. So you can change organizations. That's totally fine, as long as you're staying in a Medi-Cal safety net setting that's eligible for the program. So there's going to be a communication process that we're going to outline in the grant guide. And you need to be able to communicate to us when you're changing. And we need to be able to tell you that the new place you're going is an eligible place to serve your service obligation. If you go to a new place without talking to us, without telling us, without being in communication with us, then we determine that you are working at a setting that is not eligible, you would be in breach of contract with us with all the consequences I outlined earlier.
All right. Thank you, Christian. Thank you, Paula, so much for offering all of your expertise with this. And thank you for all of your participation in our attendees with our Q&A session. You guys have fantastic questions. And as Paula mentioned earlier, these really do help us think through these programs and make sure that we get you guys with the best service possible. We want you to be successful in these programs. If you do have more questions, please email them to the team at mbhslrp@hci.ca.gov. And now we're going to have some closing thoughts from Dr. Sharmil Shah.
Thank you, Chris. And thank you all again for joining us today for the BH Connect Medi-Cal Behavioral Health Student Loan Repayment Program informational webinar. We hope that the information shared and the question and answer period has given you a clear understanding of the program's goals, eligibility requirements, and application process. I want to say that the BH Connect program is more than just a loan repayment opportunity. It's part of a broader effort to strengthen and support California's behavioral health workforce, particularly in communities where access to care is most needed. If you have additional questions, please don't hesitate to review the resources provided within 7 to 10 days. And you can reach out to our team directly with the email address that Chris will put up in a few minutes. We encourage all eligible professionals to consider applying and to share this opportunity within your networks. So on behalf of our team and partners, thank you again for your time, your commitment to behavioral health, and for the vital work you do every day to serve individuals and families across California. Thank you again, and I will now turn it over to Chris to wrap us up.
Thank you so much, Dr. Shah. Well, we really do appreciate everybody joining us today to learn more about our Medi-Cal Behavioral Health Student Loan Repayment Program. And a special thanks to our friends at DHCS for being here with us today to answer these questions as well. We're excited to be able to offer this program as a part of the BH Connect initiative and as a part of our health workforce development efforts at HCAI, and we're grateful for your participation with us today. Just as a reminder, please be watching for the program opening on July 1 and a more in-depth webinar shortly thereafter in that July timeframe to come. And as I mentioned, we will be sending more emails and information out on that. We would love for you to follow us. Please go to our website and see all of the great resources that we have. Check us out on Facebook, LinkedIn, X, YouTube, and we're actually adding some more offerings to this as well. And so please follow us. And if you do get awarded with something, please show us some love on our social media and show some the great work that you guys are doing there. As I mentioned earlier, you can subscribe to our newsletter, and I'll show you the link on the next slide here. If you go to this link right here, you're going to go ahead and subscribe again to anything that says health workforce. You're going to get added to our mailing list, and we'll get monthly updates with us. If you absolutely must, you can give us a phone call, but I will mention that an email is a much better way of getting hold of us. And again, for this program, please email us at mbhslrp@hci.ca.gov. Thank you so much for attending and being with us today. With that, we conclude today's webinar. Have a wonderful day, and we look forward to seeing you again in July.